So my name is Mwidimi Ndosi. I'm Associate Professor in Rheumatology Nursing in University of West of England, Bristol. I'm also a researcher at University Hospitals, Bristol in the UK. My background is rheumatology nursing and really focusing on patient education and patient health outcomes. Over the last 10 years, I've been involved more in education. I've got teaching roles, looking into teaching research methods and evidence in research, but also focusing on research roles on patient education and supporting self-management and outcome measurement. HPR comes from different professions. We've got people like nurses, physiotherapists, occupational therapists, pharmacists, and a lot of other different professions, and having different roles. And some of them, because they're coming from different countries, some countries do not have, these people do not just focus on RMDs, they focus on other diseases. And they're looking into the really EULAR vision, where we're thinking about, or we imagine a world where all RMDs are recognized, diagnosed, and prevented or cured. Our committee really plays a really important role because we bring all together all health professionals to address that, the aim of addressing the impact of disease on people's lives. When I was training in the 90s, we learned diseases like rheumatoid arthritis being this progressive and debilitating disease. And there was this sentence here that says that remission was very, very difficult if it at all achieved. In 2010, remission became the goal or the target of treatment. Now that's really interesting because that shows that the field is moving very fast, and EULAR has got this unique position combining all these aspects of quality of care, research, patients, and HPR. A really good area, well positioned to be able to address the challenges of the future. Whilst now we know EULAR has achieved a lot, we know that we still have aspects of communities or groups of patients that are not necessarily achieving what we see. We know what is possible, but because of health inequalities, we know some communities and some countries are not achieving this. All what we need to do is to focus more on education, on research, and also on advocacy to ensure that these are areas of interest for all our communities and the world or globally in general. Committee is organized around 3 subcommittees. We've got a research subcommittee looking into evidence or generating evidence and see how that the evidence informs practice. And then the second committee is education committee that looks at education activities in terms of working with the EULAR school and having developing courses and webinars and other educational activities like postgraduate course. And we've got the third subcommittee which is knowledge translation committee, which is involved with dissemination and also ensuring implementation of evidence into practice. Therefore, working around these 3 committees, we contribute a lot towards the not only patient impact, but also developing the profession, but also working across different communities and our community. We also have other activities like study groups, which helps addressing the needs of health professionals, because one of our goals is to ensure we bring the health professionals' contribution into visibility, because of different variety of professions, sometimes our role is not very visible. Therefore, we'll have study groups like looking at patient education, study groups for physical activity, a study group for foot and ankle care, and study group for non-pharmacological approaches in connective tissue diseases. Our key role is to help implement and help achieve or realize the mission of EULAR. I grew up, I was born and raised in a place called Moshi in Tanzania, just on the foot of Kilimanjaro mountain in the 70s and 80s. But I really never climbed the mountain until just 3 years ago, before the pandemic. And over the years, people ask me, have you climbed the mountain? I keep saying, no, it's stupid, I can't climb. But yeah, in the end, I had to climb the mountain. And now you just need to show me a mountain, I want to climb it.